but now we have already faced the second year of war, so people are not even able to like really harvest anything from their lands and to cultivate their fields. So by missing one harvest from last year and now also this year, just like it's crazy how challenges it is for the people to get food. So food production is something that is one of our main activities in Sudan. And we, with our veterinarian expertise, we focus on livestock because in the same region where you find agriculture practices, people also have livestock, and food production, food security is something that still relies also on the livestock. So if you think about milk and meat production, and there are just like some diseases that really reduces and decreases the productivity of animals. And one is a disease, an animal disease that is called PPR, which is like the pest of small ruminants, goats and sheep. And one of the activities we did was to like bring vaccines into the country. Huge challenge because the production within the country was not possible anymore. And we did that because if you look at PPR, like one of the consequences if animals get sick and get this disease is the decrease of milk production, and especially children under 5 and under the age of 5, they really rely on that milk as one of their major food. So then the consequence of an animal getting this disease can be, again, migration. It can be also poverty, malnutrition. Yeah, I think it's the most important. And then, as I said, weakening of already vulnerable groups like youth and women, like breastfeeding women or pregnant women. So for us, and I think a lot of other NGOs, they focus more on like human health, which is also really relevant. But what we bring maybe new to the table and to the setting is that we, for example, we do vaccination campaigns. And I would say this is at the same time we're providing food for humans, we also need to take care of the still living animals and also make sure that they are still productive and healthy. Something else I want to mention here is WASH, so like water, sanitation and hygiene. Sudan is currently also grappling with like multiple disease outbreaks, like cholera, malaria, of course, dengue fever. So some diseases that are connected to like mosquitoes or as a vector, and then also other waterborne diseases or like where water sources are involved. So again, it's part of the environment. And then, yeah, water and soil just play an important role in certain diseases and their transmission. And especially if you think about then having less water sources, so then even like livestock or like domestic animals and humans, they share the same water source. And then just like general access to clean drinking water is really a big challenge. Additionally to that, we have now also floods in Sudan. So yeah, just another challenge for the people there. And I think for me, it was really interesting to understand the impact that flooding has on the increase of snake bites, because it's not very obvious that these two things are connected. But we have venomous snakes in Sudan or also in other African countries. And if there is flooding, then the incidence increase. So it's a greater risk and threat for the humans. Because these snakes, they also need to like leave their nests. So they are forced to like look around higher grounds and where the population of humans is also higher. So there's just like closer contact from like these wildlife, from snakes or between snakes and the humans. On the other hand, if you think about droughts, if you have like prolonged dry spells, snakes are also forced to seek water around human dwellings. So it's just interesting if you look like the behavior of animals and how this changed by a changed environment and a changed weather condition, and how this also then has an impact on the humans.